The driving issue was identified by our physicians at the Edmonton Southside Primary Care Network as emotionally difficult for them. Clinically, how were they going to determine that a driver was medically fit? Also, it involved a lot of angst on their part if they had known the patient for a long time and had concerns about their ability to continue driving. They had formed strong relationships with these patients, but also aware that driving has a lot of responsibility and a lot of complex tasks, and knowing that maybe this patient's health was changing and they were no longer medically fit. How do you determine accurately that the patient can still drive safely? Our physicians had let us know that they, in trying to determine whether somebody was medically fit to drive, that they were going on having to use clinical judgment. Some of them were hoping that maybe scores on standardized mini-mental exam might be helpful, realizing through the literature that that probably wasn't the most accurate tool to use, but being very unsure about what to do. We became very clear at the beginning the important piece of introducing this new protocol was a new way of going into a busy clinical practice was letting the physicians choose what population they wanted to start with. So instead of us deciding, look, you're going to use this group or that group, the physicians at this particular clinic had a high volume of driving medicals that they were involved with, and so chose to start our protocol with people who were coming in having to have driving medical forms signed. After initiating the SMART-MD protocol and the use of the SMART-MD within the clinic, after several months, because there's growing pains with any new protocol, we found that the clerks, the nurses, and the physicians, and physicians in particular, seemed to feel that this protocol had increased their confidence in being able to address the question, do I send this patient on for further assessment, or am I safe? Do I feel that they're medically fit to continue driving and I can simply sign the form? So it helped increase their confidence. We discovered along the way that through evaluation that the physicians felt that it had a positive impact on their charting, and it also had a positive impact on the amount of time. It didn't increase their time by having the nurses do the SMART-MD, and so that was an important variable for them in adopting the protocol. We found very quickly that different clinics have different focus and different priorities in their practice, and if we were going to have a clinic adopt using the SMART-MD screening tool for driving, that we had to have a variety of entry points. For instance, one clinic had chosen driving medicals as the starting for their practice. Another clinic had a high volume of clients who have diabetes, and so they preferred to look at patients who were coming in for routine diabetic checks to take a look at who needed to be screened for their driving medicals and use that as their entry point. And by allowing that kind of flexibility, it opened the door to taking a look at that cumbersome or emotionally laden practice for them and didn't become a stumbling block. What we discovered was, after some initial angst by a few patients, the majority of patients were willing to go along and realize that this was supporting clinical judgments for their family physicians and were willing to support their family physician in making good decisions, and very optimistic that they were going to pass the SMART-MD. And so that made it easier, as the majority of patients did pass. And so by word of mouth within the clinics, that initial angst by all of the participants just kind of melted away. With some of our early adopters, clinics that were involved in our initial research projects, patients who have been coming back repeatedly on a yearly basis, they're now of an age where they need to have the medical driving form filled out annually. Some of these patients have now been screened for the third time. And so it's now become part of the practice, and oh, okay, I'm having to have that screen again. And even though they may grumble a little bit, it's just part of knowing that this is what happens at the clinic. One of the advantages of developing the protocol was, along with introducing the Simard MD and teaching different staff members how to implement that tool, how to screen for who needed the tool to be done. We also provided draft letters that the staff could fill out. The nurses in particular were filling out referral forms for further assessment, but also letters that would be forwarded to driver fitness and monitoring. Just having those pieces of information has probably, number one, ensured that the protocol continues to be used because it's user-friendly. And also it provided the necessary documentation and made it readily available to the physician so that there isn't time lost trying to find the forms. What do I do? Who do I contact? Where do I send them? All of that's been provided for them.